Hello everyone. Stroke is defined as acute ischemic injury to the central nervous system. Early diagnosis and intervention is crucial for the management of patients with stroke. We all know that MR perfusion imaging has been proven to be very effective in early management of this patient. Today I am going to demonstrate how MR diffusion or perfusion scan works in these patients with stroke. For example, imagine that this is your brain and this is green is the blood vessel which supplies blood to your brain. Now I'll show you with the dye. This blood vessel is damaged and as a result this is the necrosis area which is formed. Now entire brain doesn't get necrosed and there are collateral blood vessels which supplies to this area. Let me show you these collaterals. So this area is defined as area of central necrosis, and this area which is similar to shadow of this, the light blue area, it is also known as penumbra. It represents the tissue that can be saved after treatment. MR diffusion imaging is based on diffusion and Brownian movement of water molecules. The way in this area the dye is restricted to the area of necrosis, water molecules are restricted to the area of necrosis because of accumulation and edema. There is a restricted Brownian movement of those molecules. Hence, there is less loss of signal on MR imaging, leading to brighter spot on MR diffusion scans. And this area of penumbra, where the blood supply is compromised but not completely restricted, it appears slightly brighter than the surrounding normal tissues, but we can determine it to be different from the central area of necrosis. Conversely, in case of perfusion imaging, when we inject intravenous contrast agent, it will give different contrast here in the area of necrosis because of the different T2 star of the contrast agent. Let us look at few MR scans.
Image on the left shows diffusion, perfusion and T1 and T2 mapping of rat brain. It also explains different regions of penumbra, how they appear on MRI. However, image on the right shows perfusion and diffusion MRI images and penumbra on human brain. This diagram shows diffusion weighted image and perfusion weighted image at different time points. It also shows T2 weighted images after 7 days in the same patient.
Thus, MR imaging helps us determine the area of complete tissue necrosis represented by bright spot in MRI. Also, it helps us to determine the area of penumbra representing tissue that can be saved by treatment, and effectively it helps us to determine the correct treatment plan for the particular patients with stroke. Thank you.